The member for Warren Blackwood.
Thank you, Acting Speaker, and I also follow to support this motion to the House and the fantastic contributions from the member from Churchlands, member from Vass, and the emotional, choked up, basically, well, yeah, from the member for Careen, who delivered an outstanding speech. So the people of regional West Australia are entitled to ask a simple question. We are the richest state in the nation. Much of that wealth is generated in the regions. The agriculture, mining, tourism and industries that underpin our economy are overwhelmingly located outside of Perth. So why do regional families continue to face some of the greatest barriers to accessing healthcare and aged care? This is not a new problem. The Royal Commission into Aged Care Quality and Safety handed down its final report in February 2021. It exposed systemic failures and made clear recommendations about what needed to change. And 5 years later, many of the pressures identified by the Royal Commission remain. The difference today is that the consequences are becoming harder to ignore. The evidence now shows that aged care is no longer just an aged care issue. It's a hospital issue, it's an ambulance issue, and it's an emergency department issue. The WA Health Residential Aged Care Supply and Demand Analysis released this year paints a stark picture. The report found that the demand has continued to increase while supply growth has stalled. West Australia recorded its first decline in residential aged care bed numbers in more than a decade. Investment in aged care facilities has fallen dramatically since 2019. The report projects that WA require between 1,600 and 2,700 additional operational aged care beds by 2030. That is the equivalent of between 16 and 27 new 100-bed facilities. These are not opposition figures. Those are the findings of the government's own report. The government knows there is a problem. The question is what it intends to do about it. The shortage of aged care beds has consequences far beyond the aged care sector. When an older person no longer requires acute hospital treatment but cannot access residential aged care or home support, they remain in a hospital bed. That bed cannot be used by another patient. The patient waiting in an emergency department cannot be admitted, and emergency departments become congested. Ambulances cannot offload patients, and ambulance ramping increases. This relationship has been repeatedly identified by health experts, providers and government agencies. The Minister herself has acknowledged that hundreds of older West Australians remain in hospital because aged care options are unavailable. ABC reporting has highlighted that on any given day around 200 older West Australians can remain in hospital beds despite being medically ready to leave because the aged care support they need is simply not available. National Seniors Australia has described this situation as exit block. So in plain language, that means people cannot leave hospital because there is nowhere appropriate for them to go. And when they cannot leave hospital, somebody else cannot get in. A shortage of aged care beds becomes a shortage of hospital beds, and a shortage of hospital beds becomes ambulance ramping. This is why it all matters. The public has a right to expect that after the Royal Commission, these issues will be addressed with urgency. Instead, we continue to hear that aged care is primarily a Commonwealth responsibility. Now, that is true, and the Commonwealth funds and regulates most aged care services. But that cannot become an excuse for inaction, because while Canberra may regulate aged care, it is WA hospitals carrying the consequences. It is WA ambulances sitting outside emergency departments. It is WA patients waiting for treatment. And it is WA families dealing with the fallout. The Labor government points to initiatives such as the Time to Think program. It points to transition care. It points to the $100 million low-interest loan scheme, and those programs have value. But even the government's own modelling demonstrates that the challenge is much larger than the response currently on offer. The government has identified a future shortfall measured in thousands of beds. It's a primary supply-side response in a loan scheme expected to support around 500 concessional beds. That is not a comprehensive plan. it is a partial response to a systemic problem. And there is another question that receives far less attention. Even if we build the beds, who is going to staff them? Because aged care capacity is not about buildings, it's also about people. The government's own modelling identifies the need for 1,600 to 2,700 additional beds. A rough industry rule is that every 1,000 aged care beds requires approximately 1,500 to 1,900 direct care workers. In plain language, the workforce challenge is measured not in hundreds of people, but in thousands. And that challenge becomes even greater when we consider the workforce we already have. Across health and aged care, the average workforce age is now in the late 40s. Many experienced workers will retire over the next 2 decades. So the challenge is not simply finding workers for future growth, it is replacing a significant proportion of the current workforce while expanding capacity. If the government accepts its own modelling, then several things must be true. It must know how many workers will be required. It must know where those workers will come from, and it must know how they will be trained. And it also must know where will they live and how will they be retained in the industry. What remains unclear is where the workforce plan can be found. We hear about bed shortages, we hear about workforce shortages, we hear about hospital pressures, but we do not see a comprehensive workforce strategy connecting all three. The reality is that regional West Australia is already competing for workers. Aged care providers compete with hospitals, hospitals compete with mining companies, regional communities compete with metropolitan area. Many providers rely heavily on migrant workers simply to maintain existing services. The public have a right to expect a workforce plan, because building aged care capacity without planning the workforce is like building a hospital without planning for doctors and nurses. And the building alone does not provide the care. And nowhere are these challenges felt more acutely than in regional WA. When people in Perth hear about a patient travelling from Manjimup to Bunbury for treatment, they do not often appreciate what that means. That trip is around 150 kilometres. For someone in Perth, that is roughly equivalent to driving from the centre of Perth to Joondalup, back again, and then driving back to Joondalup and almost back again. For regional people, that is not a once-off event. It's often routine healthcare. It's a specialist appointment. It is scans, it is procedures, follow-up treatments and patient transfers. Now imagine making that journey when you're elderly. Imagine making it when you're recovering from illness. And imagine making it when your family cannot take time off work. And then remember that many of these journeys are being undertaken by volunteers assisting the patients. Volunteers who have already completed a full day's work, volunteers who have already just come off a 12-hour shift, volunteers who continue stepping up because the community depends on them. This is something many metropolitan residents rarely have to consider, but regional communities live with it every day. Healthcare access is not simply about whether a service exists, it's about whether people can reach it. That is why workforce shortages matter. That is why volunteer fatigue matters. And that is why the government cannot continue viewing healthcare solely through a metropolitan lens. I recently received correspondence from a GP involved in on-call services under the Country Health Initiative. That advice provided was that the $50 on-call payment has remained unchanged for approximately 15 years. The current contract discussions reportedly extend these arrangements through to 2031. If those concerns are accurate, the government needs to explain how it expects regional healthcare services to remain sustainable under those conditions. The public standard is simple. If the government says it values regional healthcare workers, remuneration arrangements should reflect that value. If the government says it supports regional healthcare access, it must support the workforce delivering that access. If we are the richest state in Australia, why are older people waiting in hospital beds because aged care services are unavailable? Why are regional hospitals operating under sustained pressure? And why are volunteer ambulance crews carrying so much of the burden? Why are workforce shortages becoming more severe than less severe? And why do communities continue to hear about shortages while seeing hundreds of millions of dollars directed towards projects that are not addressing these fundamental pressures? These are practical questions, and practical questions deserve practical answers. There are things the state government can do. It can develop a public implementation framework showing how West Australia has responded to the Royal Commission recommendations that fall within the state's responsibilities. It can create a dedicated aged care workforce strategy. It can support workforce housing in regional communities. It can expand training pathways and regional scholarships. And it can provide bridging support for older West Australians that are waiting on Commonwealth aged care services. It can identify regional areas where market failure is preventing aged care investment and actively support new developments. It can bring together aged care, health, housing, transport, workforce planning and hospital demand into a single statewide strategy. None of those actions require waiting for Canberra. None require another inquiry, and none require another round of finger pointing. The government can say it was not warned. The Royal Commission warned about aged care pressures. The government's own modelling warns about future bed shortages, and providers warn about workforce shortages. Regional communities warn about access challenges, and the evidence is pointing in the same direction. This is not just a process issue. It affects real people in real places. It affects older West Australians waiting for care, and it affects families trying to support them. It affects volunteers driving patients hundreds of kilometres, and it affects healthcare workers already stretched thin. And it affects every patient waiting for a hospital bed when the system is full. The question now is whether the problem exists. The government's own reports confirm that it does. The question is whether the Cook Labor government will continue pointing to Canberra, or whether it will start using every lever available for it to reduce aged care pressures, strengthen regional health care and prepare Western Australia for the demographic challenge that is already upon us. That is the task before the government, and that is what West Australians are waiting to see. Thank you.
The member for Cottesloe.